Hi guys, this is Dr. Nida with Keys of Health. I hope you're doing well and taking good care of yourself. I apologize for the long absence. Last 20 months have been stressful to say the least. But alhamdulillah, I'm back and I promise to regularly upload more content, inshallah. Thank you for your messages of support and love and concern. They mean a lot to me. I value each and every one of you and appreciate your support. Thank you so much. Today's video is about stomach ulcers because a really dear friend, a family friend, is struggling with it at the moment and asked me for some advice. I decided to record a video on the topic because unfortunately it's becoming more common to be struggling with this issue because it is one of the common conditions associated with stress and imbalanced lifestyle, and understandably it's on the rise. So without further ado, let's delve right into it. So stomach ulcers are also known as gastric ulcers. They are sores that develop on the lining of the stomach. You can also get ulcers in part of the intestine just beyond the stomach, which are called duodenal ulcers or peptic ulcers. They cause the same symptoms and treatment for both is the same. The most common symptom of a stomach ulcer is burning or gnawing pain in the center of the abdomen. But stomach ulcers aren't always painful, and some people may experience other symptoms such as indigestion, heartburn, acid reflux, and feeling sick. Before I go any further, I want to stress this. Please do not self-diagnose. Do not assume you have this condition or that because you have certain symptoms. Always get a proper diagnosis. As I mentioned earlier, stress is often responsible for stomach ulcers, but we can call it an indirect cause. The two main causes of stomach ulcers are H. pylori bacterial infection, and taking anti-inflammatory medicines, NSAIDs, such as ibuprofen or aspirin, if they're taken for a long period of time. That's why stop popping pills every time you have a headache or cramps. Smoking and alcohol use are also common culprits behind developing these ulcers. Now let's get to the treatment part. You can ease the pain of ulcers, and yes, ulcers can heal. For that, you have to first understand what caused them and remove that cause. For that, I recommend consulting a naturopath to create a personalized plan for you. However, there are many things you can do to jumpstart the process. First and foremost, like always, it's the diet. Your diet is your medication. You can take everything, but if you're not adjusting your diet, it's not going to go too far. There are a few things you can add to your diet to get relief from the symptoms and hopefully start the healing process. First is cabbage juice. It's a time-tested remedy which has proved effective in many kinds of ulcers and not just stomach ulcers. So around a liter of fresh cabbage juice taken in small quantities throughout the day has shown to be very effective. In some cases, the ulcers were healed within 7 to 10 days, which is much faster than treatments with conventional medicine. Aloe vera has shown promising results in healing ulcers, and it provides effective relief from the symptoms. You can add it to your cabbage juice or eat it as is. Up to 3 tablespoons of aloe vera gel throughout the day has shown to provide relief. Licorice root is another thing. Dried licorice root is great. It helps produce more mucus in the stomach, which helps protect the lining. It is a great preventive herb against a variety of ulcers. Please do not confuse it with licorice candy, which is basically flavored sugar. Licorice has shown to be great in treating H. pylori bacteria. If the underlying cause of the ulcer is H. pylori, then your dosage might differ. Licorice is available as capsules, powder, tinctures, topical gels, and teas. If you take dry root powder, I would not recommend more than 1 gram daily. Do not use it for more than 7 days straight. Take a break for a few days before restarting it. Next is raw unfiltered honey. It's a wonderful treatment. You can take it as is, mix it with warm water, or make a mixture with bee pollen and royal jelly to make it more potent. Garlic is another great treatment. It has antimicrobial properties that can help prevent ulcers and help heal them quicker. You can eat raw garlic, but I understand it can be challenging, so garlic capsules are also a good option. Next is curcumin, which is found in turmeric. It's great. You can take turmeric capsules, but I would highly recommend making turmeric ginger tea. Take it with honey. Daily, you can take up to 3 cups a day. I would not recommend taking more than that. If you're taking it in the summer months, reduce it to 2 cups max. You can add honey to it to make it more effective. The next treatment is mastic. Mastic is a resin. Okay, this is what it looks like. 350 gram of mastic gum 3 times a day for 14 days has shown reduction in H. pylori activity. You can find this as resin or in powdered form at most Mediterranean or health food stores. Now, this might sound strange, but chilies are also helpful in preventing and treating ulcers. That's because chili contains capsaicin, an active ingredient that appears to reduce stomach acid production and enhances blood flow to the stomach lining. Both of these factors help prevent and heal ulcers. Now, I can't stress this enough. Probiotics. Probiotics are live microorganisms that provide an array of health benefits. You can find them in many foods such as yogurt, kimchi, sauerkraut, kefir, and kombucha, etc. However, if someone has an ulcer, it is better to take supplements instead of relying solely on foods because you need a much more potent dose of probiotics. Other than these include spinach, celery, cucumber, alfalfa, carrots, turnip, radish, and especially mint in your diet, fresh mint. You can chew on fresh mint leaves, drink mint tea or mint infused water. Mint is soothing and helps with the healing as well. And there's no cap to it. You can take as much mint as you want. Along with that, eat dates, bananas, grape molasses, whole grains. This is what you need in order to speed up the healing process. You can add wheatgrass and chlorella powders to your drinks, and that will also help ease the symptoms, alkalize the body, and speed up the healing process. Now, along with what you need to take, there are a few things that you need to avoid. Milk, tea, especially milk tea, coffee, alcohol, smoking, and fried foods have to go. Keep your diet light and fresh. Avoid foods out of packages. Avoid fast foods. Make sure you're consuming a nutrient-dense diet, not a calorie-dense diet. Drink plenty of water. By the way, lack of water has shown to cause ulcers. So those of you who don't like drinking water, take this as a warning shot and start increasing your water intake. Another thing you want to be mindful of is not drinking tap water. Drink good mineral water instead, especially when you have stomach ulcers. Drinking barley water is also quite helpful in this condition. As I mentioned earlier, ginger turmeric tea is also good in this case. You can also drink licorice, chamomile, vervain, and linden tea to help soothe the symptoms and help heal the condition. Try these and let me know what worked best for you. This is it for this video. I will see you soon with another topic. Until then, take good care of yourself. And if you haven't already done so, please like and share the video and subscribe to the channel. You can also send me your recommendations of what topic you would like me to cover next. Goodbye for now.